Today we will be testing for range of motion and manual muscle testing on the lower extremity hip. First will be range of motion testing for hip flexion. The patient is to be lying supine with the hip and knee in 0-degree neutral extension and rotation. The goniometer should be placed so that the axis is on the lateral aspect of the hip over the greater trochanter of the femur. The stationary bar is centered over the middle of the lateral aspect of the pelvis, and the movable bar is parallel to the long axis of the femur on the lateral aspect of the thigh. During the motion, the knee should be bent. So the client will flex their hip, and the reading should be between 0 to 120 degrees.
The reading for this one is 101.
Okay. Now we will be testing for range of motion for hip extension. The client is to be positioned in prone, lying with the hip and knee at 0-degree neutral extension and rotation with the feet over the end of the table. The goniometer is placed the same as for hip flexion, with the axis on the lateral aspect of the hip over the greater trochanter of the femur. The stationary bar is centered over the middle of the lateral aspect of the pelvis, and the movable bar is parallel to the long axis of the femur on the lateral aspect of the thigh. The knee should be extended during the motion. Okay, so normal range of motion should be between 0 to 30 degrees.
Hannah had 35 degrees.
Now we will test for hip internal rotation range of motion. The client should be seated with the hip in 0-degree neutral rotation, with the hip and knee flexed to 90 degrees. The knee is flexed over the end of the treatment table. A small roll or towel can be placed under the distal end of the femur to maintain it in a horizontal plane if the patient needs it. And the contralateral hip can be abducted and the foot supported on a stool if the patient needs that as well. The goniometer should be placed with the axis on the center of the patella. The stationary and movable bars are parallel to the longitudinal axis of the tibia on the anterior aspect of the lower part of the leg. The stationary bar should remain in this position, perpendicular to the floor, whereas the movable bar follows the tibia as the hip is rotated internally. Normal range of motion for hip internal rotation should be 0 to 45 degrees.
Hannah had 40 degrees.
Okay, now we will test for hip external rotation range of motion. Again, the client is seated with the hip in 0-degree neutral rotation, with the hip and knee of the leg to be tested flexed to 90 degrees. The other leg should be either flexed at the knee so that the lower part of the leg is back under the table, or flexed at the hip and knee so that the foot is resting on the table. These positions allow the motion to take place without obstruction. The trunk should remain erect during performance of this motion. The goniometer is positioned as for internal rotation, with the axis on the center of the patella, the stationary and movable bars parallel to the longitudinal axis of the tibia on the anterior aspect of the lower part of the leg. The stationary bar again remains in this position, perpendicular to the floor, whereas the movable bar will follow the tibia as the hip is rotated externally. And normal range of motion for hip external rotation is 0 to 45 degrees.
Hannah had 35.
Now we will do manual muscle testing for hip flexion. The client should be seated with knees flexed over the edge of the table and feet above the floor. The therapist should stand next to the client on the side being tested. Stabilization should be provided at the pelvis, at the iliac crest, on the side being tested. The client may grasp the edge of the table or fold their arms across their chest. The psoas and iliacus are difficult to palpate, so the rectus femoris may be palpated on the middle anterior aspect of the thigh, just lateral to the sartorius muscle. The therapist should observe the client flexing the hip so that the femur rises above the table surface. If the client can perform this action, the therapist should then provide resistance just proximal to the knee on the anterior surface of the thigh down toward the table into hip extension. If the client can perform this motion against full resistance, they will receive a grade of 5. Now we will manual muscle test in the gravity eliminated position for hip flexion. The client should be in a side lying position with the therapist standing behind the client, supporting the upper leg in neutral rotation and slight abduction with the knee extended. The lower leg to be tested is extended at the hip and the knee. The weight of the trunk may provide adequate stabilization, or the therapist may stabilize the pelvis if needed. The client is then palpated in the same manner as described for the previous test over the rectus femoris on the middle aspect of the thigh, just lateral to the sartorius muscle. The therapist should observe the client bringing the lower leg up toward the trunk, flexing the hip and the knee. Now we will manual muscle test for hip extension. The client should be prone with the hip at neutral and the knee flexed to about 90 degrees. This position is used to isolate the gluteus maximus. The client may also be prone with the knee extended if they need to be in that position. The therapist stands next to the client on the opposite side being tested. If the client needs more stabilization, pillows can be placed under the pelvis to flex the hips. Stabilization should be provided over the iliac crest on the side being tested. The therapist should palpate the gluteus maximus on the middle posterior surface of the bottom. The therapist should observe the client extending the hip while keeping the knee flexed to minimize action of the hamstring muscles on the hip joint. The therapist should then provide resistance at the distal end of the posterior aspect of the thigh downward toward flexion. If the client can perform this action, they will receive a muscle grade of 5. Now will be manual muscle testing for hip extension in the gravity eliminated position. The client should be in a side lying position with the therapist standing in front of the client, supporting the upper leg in extension and slight abduction. The lower leg being tested is flexed at the hip and the knee. The therapist should provide stabilization at the pelvis over the iliac crest. The therapist should palpate the client over the gluteus maximus muscle on the middle posterior surface of the bottom. The therapist should observe the client extending the hip, bringing the lower leg backward while maintaining flexion of the knee.